Today we're going to talk about lower back pain. The lower back is that part of your body extending from just below the rib cage, going downwards towards your bum. Now, there are a lot of causes of lower back pain. Some of them are intra-abdominal structures. We are not going to concentrate on that. We're going to leave them out. Some of them are general medical condition called inflammatory arthritis. We're not going to talk about those. The important thing is to let you be aware of what we call the red flag in musculoskeletal medicine. The red flags are things that are very dangerous, that can lead to severe disability. What I'm talking about here are infections of the spine, osteomyelitis. I'm referring to cancers in the spine, osteosarcoma. It can also be metastatic cancer, meaning cancer coming from somewhere else. You can also have disc prolapses that are impinging on the nerves that come out of the lumbar spine, a radiculopathy. Those are quite important. We need to rule out those because they require urgent medical attention. But the object of this discussion today is the more common cause of back pain. That will be soft tissue back pain. By soft tissue, in this context, I'm referring to the ligaments and the muscles of the lower back. When you pull a muscle beyond its ability to withstand the pressure you are pulling it, you get what's called a strain, and that will hurt. Depending on how hard you pull it, how hard you went beyond the threshold for its ability to cope with the excess force you're putting on it, it can be extremely painful or just a mild pain. Same applies to ligaments in the lower back. So strains occur when a muscle is stretched too far and tears, damaging the muscle itself. Sprains happen when overstretching or tearing affect ligaments, which connect the bones together. For practical purposes, it does not matter whether you have a strain or a sprain because the symptoms are similar and the treatment is similar. When you have mild pain lasting a short period of time, it's fine, you can just take painkillers. But if it lasts more than 72 hours or so, or is very severe, I would suggest you go and seek professional help from a physician or a physiotherapist. What are the common causes of back sprains and strains? Lifting a heavy object or twisting the spine when lifting. That could lead to a sprain or a strain. Sudden movement that places too much stress on the lower back, such as when you're falling from a height. Poor posture over time. I'm sitting here like a couch potato. If I stay here for a very long period of time, say the whole day or 2 days, I will end up with back problems. Sporting injuries, especially in sports that involves twisting and large forces of impact, such as cricket when you're bowling, football at times when you have to run and twist, wrestling and lose, and so forth and so forth. Now, acute back problems or back pain last less than 3 months. Normally, it just recover on its own without any treatment, but it can become chronic. Chronic back problems can be a problem. The doctor will give you painkillers. Sometimes they don't have any effect whatsoever. Sometimes get a little bit better, but it comes back again. You go to see your physiotherapist or a chiropractor. Doesn't make a lot of difference. Sometimes it gets a little bit better, but it keeps coming back again. Therefore, when this happens, when it's chronic, you don't have to stay at home and just live with it. You need to go and see a specialist in musculoskeletal medicine. You can see an orthopedic surgeon. If you require surgery, they'll operate on you and fix the problem, particularly with regard to the red flags that I've already spoken about. So if you have a chronic back pain that's causing you a problem, you come and see us. We will ask you questions, taking history. We will carefully examine you and systematically eliminate factors or tissues that are not causing the problem until we identify the one that's causing it. In the chronic phase, you may have had a back injury affecting one muscle, but because of neurosensitization, other muscle groups are affected, or even sometimes soft tissue far away from the area of the back can be affected. But that's our job, is to make sure that we identify all the structures that are affected. Now, if you go down below the back to the butt, there's the gluteus medius muscle and the piriformis muscles. These muscles can go get a strain, or they can have what's called trigger point, again, knots in them. That gives a lot of pain in that area. In the same area as well, you got what I call Bess's fluid-filled sacs that are found in association with joint, which are part of the lubricating mechanism of joints. They can become inflamed. A bursitis is called. These can be identified and treated. At the back as well, in the butt area, between the pelvic bone and the backbone, or the sacrum or tailbone, part of the tailbone, there's a joint called sacroiliac joint. We can examine you and identify that to be the cause of the problem, mainly the ligament in between, but you can get some inflammatory conditions affecting that joint too. Even lower still, in the coccyx, the tailbone, you can get what's called coccydynia. Coccydynia, pain in the coccyx, pain in the tail. We can also identify, it's very, very easy to diagnose by clinical examination and x-rays. Let me go to imaging. Images are quite important, but the person who's ordering them must know exactly what they're looking for. Because you can find some abnormalities that have nothing to do with the symptoms. For example, some people come in with lumbar spine MRIs, and these scans will show that you have disc prolapse. But if you look at the symptoms and the nature of the symptoms and the findings are not consistent. There are a lot of people walking around who are perfectly fine who have abnormal MRIs. So one should be careful in interpreting these things. Right, so having done all that, we know exactly what the problems, and we can treat it. We can look at the way you, the initial cause of the problem, and try and deal with that. For instance, if we find that the cause of your back problem is occupationally related, we can try and teach you how to do your work better. We can do an ergonomic assessment of your workplace and then give appropriate advice. We can, having done all that, we will treat the back problem. It will get better, I can assure you. Once it's better, we can prescribe an exercise prescription to try and strengthen and tone those muscles that have had a problem. That applies to the lower back, to the butt, what I call the Hashimoto syndrome, to the tailbone. Also, we can give you exercise to try and prevent what has happened. Therefore, you've got chronic back problems, back pain, give us a call and we will see if we can assist you. If we identify anything dangerous, we'll refer you to the appropriate specialist. I hope this information is useful, but you can communicate with me if you've got any further questions.